Welcome back to Instagram Live Friday. Sorry, I had some technical difficulty, but we are here today waiting for Dr. Ashwin Mehta to join us as we are so excited to have him on as a special guest today to talk about integrative medicine. So just bear with us as our speakers joining us, and we have again Memorial Healthcare System, which is one of our on today to talk about some of their programs and what they could help us with in our community. So again, Dr. Ashwin Mehta will be joining us. Good afternoon. How are you?
Hi there. Doing well. How are you doing?
I'm good. Thank you so much for joining us. We look forward to our conversation.
Thanks for having me on.
Perfect. So, why don't you take this time to maybe just do a short introduction of yourself and who you are? As I just had announced, Memorial's one of our New Year sponsorships for 2021, and we look forward to hearing about all the different programs that Memorial has.
Sure. So my name is Dr. Ashwin Mehta, and I'm the medical director for Integrative Medicine here at Memorial Health, and specifically with Memorial Cancer Institute. I am an internal medicine physician by training. My subspecialty within medicine is actually sleep medicine. And in integrative health, we use all manner of behavioral and preventive and non-pharmacologic, non-surgical methods of improving quality of life throughout the spectrum of cancer care.
When we talk about integrative medicine, can you explain what that is to our community?
Sure. So the way I like to describe it is if your body's a garden and cancer is an unwelcome weed, it's your oncologist, your radiation oncologist, your surgeon's job to eradicate the weed. It's our job as an integrative medicine team to help you strengthen and nourish the garden. And that's really what integrative health is all about. So, for example, during cancer treatment, what we do is we draw upon the wisdom of ancient healing traditions from all over the world, and we combine these with modern medical technology in order to improve outcomes for everyone who is undergoing cancer treatment. So we want to take as proactive and preventative an approach as possible. So we actually coach our clients to drink enough water, to exercise regularly, even during treatment, to get good sleep, to be mindful of their moods and emotions and how those are impacting how they're feeling. Nutrition is huge. So everyone gets a nutritional recommendation, a mindfulness meditation prescription, an exercise routine, and really those are sort of the central pillars of integrative health. And we're also joined by two fantastic acupuncture practitioners who have collectively a vast amount of experience between the two of them in providing acupuncture treatments, for our patients. They treat everything from neuropathies to nausea, reduced appetite, reducing the inflammatory burden in the body, cancer-related pain, or any even treatment-related side effects that may pop up. So we have a phenomenal team, and we're really proud that Memorial Health has really the region's only comprehensive physician-led integrative program at a cancer center in South Florida. So we're delighted to have this opportunity, and it's really been a great journey over the past over 5 years now.
Awesome. Well, how does integrative medicine help breast cancer patients during and active treatment and after treatment?
One of the we call integrative we call the integrative approach a patient-centered approach. So how we help is really directly up to our patients. One of the first things that I ask our patient, a patient who comes in to see me for a consultation, is, what are your goals? What are your priorities? What would you like to achieve during our time together? So it's a patient-centered approach. Patient-centered means our patients are the ones who are telling us what their health, physical and mental health goals are, and we customize an individualized program for each patient. So it's not, although we begin with certain fundamental principles that pertain to good health and preventive health, like hydration, nutrition, exercise, good sleep, and mindfulness practices. That's just the starting point. We do have a wonderful green pharmacy as well, and that is a dispensary where the top quality vitamins, herbs, and supplements over the counter are also recommended as a complement to other things that they may be doing. So we have a green pharmacy as part of our integrative program, because there's a lot of misconceptions with regard to vitamins and supplements out there and how useful they can be. We take a very cautious approach. Every supplement that we recommend is cross-checked with medications that our patients are on, and just to make sure that there's no drug-herb interactions. And we take a less is more approach when it comes to supplementation, but when we do recommend supplements, we want them to be of the highest quality. The best manufacturing processes involved with these vitamins, herbs, and natural health products. So green pharmacy is a component of what we do. And a lot of patients come to us with questions, should I be taking this during treatment? Should I be taking this during survivorship? So patients come to us with a lot of questions. We have entered an era of the informed healthcare consumer. Before people even pick up the phone and schedule an appointment with us, they have read our reviews online. They know what we offer. They know what we don't offer. Most people who come and see me are already pretty well informed. And so how we can guide them to adhere to evidence-based, science-based practices that really are well studied in the medical literature. To that degree, they are going to be doing better, improving their quality of life, improving their overall satisfaction during treatment and beyond.
Is there something different about treating women with cancers that are associated with hereditary genes?
I would say that there is. I would say that most patients who come and see us who have had some type of genetic predisposition for cancer, there is an urgency. There is because ultimately, to date, we don't have much that we can do about our genes. Really, our genes are our genes, and yes, certain things that we do can actually turn genes on or turn genes off. That much is true. And actually, so much of what we coach in the integrative space that pertains to healthy lifestyles, all of those lifestyle behaviors are exactly those things that can turn the healthier genes on and the less healthy genes off. So, I think that there's a significant urgency to hereditary cancers. The way that I describe the hereditary cancers, you see, our genes are like an architectural blueprint, and our cells, the cellular machinery, has to interpret that architectural blueprint. So the construction workers, the electricians, the contractors, the plumbers, all those people who actually take the blueprint and create the building, that is our cellular machinery. And so how we interpret that blueprint is actually it differs from one person to the next, largely based on our lifestyles. So there's the genome, which is the architectural blueprint, and then there's this layer called the epigenome. And the epigenome is all that cellular machinery that is interpreting the blueprint to give us the physical body. So I think that when it comes to hereditary predispositions to developing cancer, I think that there's an urgency. Most of our patients are very motivated and engaged at understanding how the epigenome can impact their long-term health and survivorship. So I think that there's an urgency, and also those individuals who are motivated and who are engaged in their health are the ones who do the best with an integrative practice, with an integrative approach, because it's the day-to-day, week-to-week, and month-to-month application of these positive health behaviors that really makes a difference long-term.
What are the long-term health benefits of incorporating practices like this to our lives?
They're amazing. One of the most important aspects of integrative medicine is to encourage our team to model those healthy behaviors for our patients. So I can tell you that there's nothing that I recommend that I haven't at least tried or that I don't do habitually. So really, we like to, number one, we have to practice what we preach from a health practitioner side, and that has had its challenges over the last year and a half. to 2 years during this pandemic, we've taken so many strides forward and then a couple of steps backwards as well. And that roller coaster of emotions has really put a significant stress on our frontline healthcare personnel. And so our integrative team is also really proud to be involved with physician wellness, with employee health, because who's going to heal the healers? I mean, that's really one of the most important aspects of being in the health in a medical professional is to make sure that self-care and that self-compassion is there, so that we really are practicing what we're preaching, and then we can more authentically and sincerely connect with the patients whom we're caring for. So the long-term benefits include, better sleep quality, better energy during the day, better nutritional practices, and just a greater sense of subjective well-being. I think that's incredibly important in any phase of the cancer journey.
A couple of questions came through. Does MHS do virtual consults for women who are not in the state of Florida? Do you know?
So we do use telehealth. However, I'm a medical professional licensed in the state of Florida. So, there may be some rules and regulations that govern scope of practice when it comes to outside the state of Florida. I'm happy to, but again, I work within a large medical system known as Memorial Healthcare System, and we just have to abide by those protocols and procedures.
Perfect. And then one other question that came through is, what about probiotics when you're on chemo treatment? Is that something you can answer from a non-medical standpoint?
Sure. So one thing that is pretty well established, it's the diversity of the microbiome. So think about the microbiome like a tropical rainforest with thousands of healthy species of plants working in an ecosystem. Now, our microbiome actually works in synergy, in tandem with our immune system. So the diversity, the biodiversity of our tropical rainforest is a very significant predictor of success with regard to treating any medical condition. And unfortunately, what ends up happening is because some of the foods that we're eating are high in preservatives. What are preservatives? They're effectively anti-spoiling agents. So antibiotics, anti-mold agents, antifungal agents. Well, those antimicrobial agents actually function the same way inside our digestive tract. So gradually, our tropical rainforest is actually being worn down over time. You put that together with the unscrupulous use sometimes of antibiotics, and your microbiome is all of a sudden kind of losing its biodiversity over time. Mm-hmm. And so, one of the most important ways of improving the microbiome is to take in higher amounts of fiber daily. So think about the prebiotics. The prebiotics are incredibly important. Before we talk about probiotics, let's talk about prebiotics. Now, prebiotics come in the form of plant-based foods. So plant-based anti-inflammatory nutritional practices that include a high intake of cruciferous vegetables, leafy green vegetables, root vegetables, fruits, nuts and seeds, beans and legumes, lentils. These are all very healthy, high fiber containing foods. The more fiber that we take in, the healthier our microbiome. So you can think of these prebiotics, the fiber, as actually kind of like a fertilizer for our tropical rainforest. Now, do some people also need probiotics as well during the context of treatment? The answer is yes. There's a wonderful research collaboration between scientists in Canada as well as Ireland, that they actually discovered that the breast tissue has its own microbiome. So interestingly enough, we thought that the microbiome was pretty well isolated within our digestive tracts, but as it turns out, different tissues throughout the entire body have its own ecosystem. We have different organ systems have their own ecosystem, their own microbiome. So it's incredibly important that we support a healthy microbiome. These researchers found that in samples of breast tissue that contained high degrees of healthy bacteria, there was a lower incidence of cancer, of breast cancer. Those women who had high concentrations of negative inflammatory bacteria, like E. coli, for example, had a higher incidence of breast cancer. So the microbiome is very, very important. It's actually a component of our immune system. And there are behaviors that we can adopt to help support the diversity of our microbiome, including, number one, plant-based nutrition and increasing our fiber intake. That's the prebiotic. And number two, using probiotics in a very judicious way in order to help support the microbiome. And I also must say that you need to be very vigilant about your white blood cell counts. So we never provide probiotic supplements to those individuals who are immunocompromised or who have dropped their white cell count. So it's incredibly, this is one of the reasons why it's very important to take a less is more approach when it comes to supplements, including probiotics. I mean, do we recommend probiotics? You bet we do. Do I use probiotics in my own life? You bet I do. But when it comes to during treatment, we take a very cautious and careful approach, and we want to make sure that those white cell counts are holding, and that there's no evidence of anyone being immunocompromised when we are actually introducing exogenous bacteria in the form of a probiotic.
Thank you. What is one part of the integrative medicine program that if the patients had to pick one that you would recommend they practice?
You know, I think that what happens in the body impacts the mind, and what happens in the mind impacts the body. So I think that if there was one sort of high impact practice, it would be the practice of mindfulness and meditation. You know, there are so many wonderful things that come out of a sustained practice. Enhanced self-awareness, increased feelings of gratitude, you know, better remembering what it feels like to experience that self-love, that self-compassion that is so incredibly important. So I think that as a fundamental practice, you know, when we really engage in self-compassion sincerely, then all of a sudden we find that we're more prone to be more physically active. We're excited about exercise. We take that time, that space in our lives to really incorporate these positive health behaviors into our daily and weekly routines. So I think that a mindfulness practice is really kind of a fundamental because you know, we see a lot of matriarchs in our cancer program, in our cancer center, and you know, one of the most common things that I hear from our matriarchs is that they're taking care of oftentimes 3 generations: a senior generation, their spouse, as well as their kids, or sometimes even grandkids. So they're taking care of multiple generations. They're oftentimes holding down a full-time job and managing and maintaining a home. So that is like the job of 3 or 4 people that one person is doing. And what I find very commonly is that our matriarchs are neglecting their own health. They are prioritizing the well-being of other people over their own. And you can only do that for so long. That is not a sustainable way of life. So you know what they say on the airplane? They say, put the mask on yourself first, and then administer assistance to those around you, right? And oftentimes our matriarchs are just like healthcare practitioners are oftentimes guilty of doing the very opposite, of making sure everybody else's well-being has been prioritized over their own. And that habitual self-neglect has contributed to health concerns over time. So this is why it's really important. In fact, I came up with a mantra of the matriarchs. This is an affirmation that I recommend for my matriarchs who have this habit of self-neglect, or who really need to reprioritize their own health and themselves, and really embody that self-compassion that is so important. And the affirmation goes something like this: me first, my space, my time, my health, my peace of mind. Me first. So it's me first, my space, my time, my health, my peace of mind, me first. So, and there's oftentimes feelings of guilt that accompany putting me first again. And so we have wonderful mind-body medicine trained psychologists, Dr. Kumar and Dr. Ketterer, here at Memorial Cancer Institute, and they are so great at coaching our cancer patients, our breast cancer patients, our matriarchs, and our survivors through those feelings of guilt, using positive health behaviors and positive health psychology, really, to optimize quality of life during cancer treatment. So it's something I really feel privileged to be able to work with matriarchs and cancer patients, sometimes in their most vulnerable times during their lives, and really coach them to incorporate that wellness and resilience that they so deserve.
And I think that's a really big missing piece in our field, right? It's like coaching our patients and guiding them and having programs incorporated like this. And I think not every center has them, or not every state. And this is why it's so important for us to come together and speak and share what's out there. Because when we talk about like self-compassion, self-love, and feeling guilt, our therapists talk about that, like not many physicians do. And I think that plays a really big role in our healing and our mental state of mind. And knowing like the 5 affirmations that you said, if you guys didn't write them down, maybe we can write them down and share. And I think that that's a good piece of advice. Normally I say, like, what's a good piece of advice that you want to share with the community? But right there, positive affirmations, and just remembering them and sharing them. And whether you repeat them every day or you post them on your mirror, ladies, these are good ways to help us heal and meditate and take that time if you can, because you need that time. We all get overwhelmed. We all think we're super women in treatment, hereditary genes. We think we can just keep going until, like you said, you end up not taking care of yourself and you're at the end of the list.
Absolutely.
So, in the process, which helps the integrative medicine team decide what treatments that the patients will have as they become patients of the integrative medicine team?
So I think that oftentimes we go by what's in the science. So for example, there's good literature to support that acupuncture can be helpful for neuropathy. Acupuncture can be helpful for aromatase inhibitor associated arthralgias, the body aches and bone pains that come from medications like tamoxifen or exemestane. These aromatase inhibitors. So we go with what's in the science typically, and then we also take into consideration what our patient has familiarity with. Some patients are have an aversion to needles and would prefer massage, or some people have experience with therapeutic yoga. Some people have experience with mindfulness and meditation. So it's integrative. The art of integrative medicine is really meeting our patients where they are, and then kind of applauding all of those wonderful things that they're already doing from a positive health behavior standpoint in order to improve their overall quality of life, and then gradually raising the bar for them little by little in each area in order to, that's where the coaching comes in. So I sometimes joke with my patients, I'm part problem solver, I'm part a motivator, and oftentimes, I'm part health coach as well. So that's where the art of integrative medicine comes in, and every patient gets sort of an individualized approach. It's never a one size fits all type of philosophy. So we go with what's in the science. We meet our patients where they're at, and then gradually coach them towards whatever their goals are. And sometimes there's shifting priorities. So goal setting is also an art form. For example, I have a lot of patients in the survivorship period who come in and say, after treatment, I was expecting to lose weight during cancer treatment, but I gained so many pounds during cancer treatment. So, oftentimes goal setting is an art. And I say, listen, it's not about losing weight. We are so sort of fixated and preoccupied with what the scale says, without understanding that sometimes you can be increasing lean body mass. You can be building back bone density and muscle tone, and also losing excess body fat at the same time, yet the scale says you stay the same weight. So we offer a comprehensive body composition analysis test, which can actually give us greater insight into how much of us is body fat? What is our body fat percentage? What is our basal metabolic rate? How many calories should we really be eating and drinking on a daily basis? How much of this is visceral fat? And which muscle areas, which parts of the body are more toned than others? So this helps us fine tune our exercise recommendations. So in order to build lean body mass and build back bone density, as we know that one common concern with aromatase inhibitors is a gradual loss of bone density. So it's really important, especially in patients who are taking aromatase inhibitors, to coach them about what types of exercises they could be doing, the core body strengthening exercises, the resistance training exercises, in order to build back up that bone density and muscle tone and help to reduce the excess body fat. We know where a lot of estrogens hang out. A lot of estrogens and toxins in the body hang out in our adipose tissue. So when we are reducing our percentage body fat, we are actually detoxifying. We are actually decreasing the size of the reservoir in which estrogens can hang out in the body by reducing our excess body fat. That's why we really advocate the use of these body composition analysis tests that are completely non-invasive. You just stand on a scale, you hold onto these handles, and it uses a technique known as bioelectrical impedance. So it puts a microcurrent through the body, and based on the speed with which that current traverses different body areas, it gives us an analysis of body fat percentage, basal metabolic rate, and also percentage body fat, as well as which areas of the body may be stronger or could use some specified training, resistance training, in order to improve that bone density and muscle tone.
One of the questions I saw one of the ladies asked is, can integrative medicine help with women who took preventative action against breast and ovarian cancer due to a genetic mutation, and they're not on hormone therapy? Does that fall in the category of integrative medicine? Is there an approach for that?
So, I just want to be careful that, what we practice is integrative. We never reject what is in modern medicine. So integrative means using complementary modalities in partnership with the standard of care. So, whatever is recommended in terms of prophylaxis by your oncologist or any other doctor should be what you follow. We help support that. In other words, if there are prophylactic surgeries that are indicated, we help heal after those prophylactic surgeries have been done. We help coach with regard to positive health behaviors that can be incorporated into daily routines in order to really strengthen the immune system and reduce the inflammatory burden in the body. And so that's what we do. So we don't call ourselves alternative for a reason. We're not an alternative to standard of care. We are very much complementary and integrative in our approach. So that needs to be highlighted. Additionally, we do have what is known as a high risk clinic. So patients who have come in and have been diagnosed with what is known as stage 0. In other words, it's not cancer, but it's kind of an area that's smoldering and could potentially develop into cancer. So that is a high risk group. And so we work in tandem with our breast surgeons and our breast oncologists in order to coach patients what types of lifestyle behavioral modifications can be done in order to mitigate that high risk. So again, all the things that we apply in the integrative space are very useful when it comes to mitigating high risk, especially and preventing breast cancer.
Perfect. Well, thank you so much for coming on and joining us today. We look forward to having you back on in the future to talk about more of your programs and Memorial Healthcare System. Thank you so much for joining us and giving us support to make sure that we're definitely educating the community and letting them know about different programs, because it's so imperative. Again, it's just not about your surgical aspect. It's about healing and getting through it and the different topics that we spoke about today. So thank you so much, and I hope you have a great weekend.
My pleasure, Tracy. Thanks for having me on, and thanks for all that you do.
Perfect. Thanks. Take care.
Take care. Bye-bye.